अस्सलाम वालेकुम। मेरा नाम डॉक्टर साजिद है। मैं कंसल्टेंट चाइल्ड स्पेशलिस्ट हूँ। टुडे वी विल डिस्कस ए केस ऑफ फुट ड्रॉप। योर कमांड विल बी डू द लोअर लिम्ब एग्जामिनेशन एंड रेलिवेंट और पेशेंट हैविंग डिफिकल्टी इन वॉकिंग, assess the child and make diagnosis. First of all, introduce yourself and take informed consent. जैसे मेरा नाम डॉक्टर साजिद है, मैं आपके बच्चे का मुआयना करूँगा जिससे इसकी बीमारी की तशख़ीस में मदद मिलेगी. देन मेक ए गुड एक्सपोजर ऑफ द पेशेंट. द गुड एक्सपोजर विल बी मिड थाई टू मिड चेस्ट. इफ़ कोल्ड वेदर, rub your hand. Then make a position of the child. Like head should be straight, arm should aside, and leg should be straight, and body will be in one plane. Then do observation at foot end for at least 15 seconds. Take respiratory rate for 6 seconds. Have a look on alertness of the patient. Any NG or Foley has been placed. If the child is older enough, talk to him to say for kalma, to check nasal twang, explosive speech, or dysarthric speech. Meanwhile, have a look over the lower limb carefully for the muscle mass. Then come to the side end for chest movement and any shallow breathing. Your first command will be gait. Follow the same scheme. क्या बच्चा चल सकता है? अगर नहीं चल सकता तो जीबीएस और ट्रांसफर माइलाइटिस होगा. अगर एक साइड पैरालाइज है तो स्ट्रोक होगा. And if the patient is not moving one lip, then think about the polio or traumatic neuritis. Suppose अगर बच्चा चल सकता है और फुट ड्रॉप है या हाई स्टेपिंग गेट है, then think of only 3 differential diagnoses. Either this will be the case of the chronic GBS, hereditary motor sensory neuropathy, or Friedreich ataxia. So gait is crucial in this case. Meanwhile, if the patient having ataxia too along with foot drop, then think of the Friedreich ataxia. Then must do Romberg test, which is positive in Friedreich ataxia. Now we have to do the motor examination to confirm that what is the most appropriate diagnosis. So do the lower limb examination. First, check the tone. In case of chronic GBS, tone will be normal or decrease. In case of Charcot-Marie-Tooth disease, tone will be normal, and in Friedreich ataxia, it will be increased due to corticospinal tract involvement. Power will be 3 to 4 by 5 in chronic GBS, while 4 by 5 in Charcot-Marie-Tooth disease and Friedreich ataxia. Reflexes will be markedly decreased in case of chronic GBS, while in Charcot-Marie-Tooth disease, knee affected later, but ankle reflex is lost. In Friedreich ataxia, knee reflex is present or exaggerated, and ankle reflex is absent. Planters are downgoing in chronic GBS, same in Charcot-Marie-Tooth disease, while in Friedreich ataxia, the planters are upgoing. Bulk normal to reduce in case of GBS, while in Charcot-Marie-Tooth disease there is markedly reduced bulk while normal in Friedreich ataxia. Now check the sensation of the lower limb. Place a pinhead over shin to check for painful stimulus with closed eyes. Meanwhile, thumb finger should up and down for position sense. We are checking dorsal column and spinothalamic tract. Sensation of the lower limb is markedly affected in form of pain and temperature and touch in case of chronic GBS, while in Charcot-Marie-Tooth, hot, cold, and touch sensation is more affected. But in case of Friedreich ataxia, 2-point discrimination, position sense, and vibration sense is affected. Meanwhile, check the bladder. Bladder is filled can be filled or it can be normal in case of chronic GBS, while it would be the normal in case of Charcot-Marie-Tooth disease and Friedreich ataxia. Cranial nerve can be affected in chronic GBS in the form of bulbar involvement, but there would be no involvement of the cranial nerve in Charcot-Marie-Tooth disease and Friedreich ataxia. CVS examination check S1, S2, and it would be the normal in case of chronic GBS, Charcot-Marie-Tooth disease, but in case of Friedreich ataxia, displays apex beat and murmur can be present. Then check the abdomen for liver, and this would you check only just if the patient having the finding of hypertrophic cardiomyopathy secondary to Friedreich ataxia. So in case of failure you can check the liver. Then cover the patient and say thanks to the patient. Description of the Charcot-Marie-Tooth disease, and this was my exam case too. A 7-year-old who is conscious, alert, well cooperating during my examination, having cannula on the right hand with respiratory rate of 20 per minute. Patient having uniformly reduced bulk in the lower limbs. During motor examination, patient having high stepping gait, tone is normal, power 4 by 5 in lower limb, knee reflex is present but ankle reflex is lost. Bilateral plantars are downgoing while upper limb examination is normal. Upon extension of my examination, Romberg sign is negative. There is no bulbar involvement, bladder is not palpable, and S1, S2 is normal without sign of failure. On the basis of my examination, my differentials are Charcot-Marie-Tooth disease, chronic GBS, Friedreich ataxia. Now just gave name of the investigation like nerve conduction study, CSF examination, sural nerve biopsy, auditory somatosensory, evoke potential studies and echo. अब अगर वो आपसे किसी भी इन्वेस्टिगेशन की डिटेल पूछता है तो आप उसको बताएं लाइक NCS it will be reduced in chronic GBS and in Charcot-Marie-Tooth disease but normal in case of the Friedreich ataxia. CSF examination show increased cytoalbumin dissociation in GBS and increased protein in Charcot-Marie-Tooth disease. Sural nerve biopsy onion bulb appearance, which is histological diagnosis only suggestive of Charcot-Marie-Tooth disease. Auditory somatosensory work potential studies are markedly reduced in Friedreich ataxia. Echo can show hypertrophic cardiomyopathy in case of the Friedreich ataxia.